Hello, my name is Rita Beam, and I'm currently a retired public health nurse, but still volunteering in public health, and also working as a public health nurse consultant. I've spent most of my career in community health nursing and public health, and it's my pleasure as a member of the CPHA Public Health Nurse section to interview a public health nurse from Colorado. These informal interviews are being conducted to give public health professionals and nurses from other specialty nursing practices an opportunity to learn a little bit more about public health nursing roles. Today's interview showcases just one of the many roles that public health nurses in Colorado and across the nation actually fulfill. So now I'd like to introduce you to Stacy Hernandez from Jefferson County Health Department. I'll turn it over to Stacy to introduce herself and her public health nurse role.
Thank you so much. Hi, everybody. My name is Stacy Hernandez, and I'm a nurse with Jefferson County Public Health. I've worked with Jefferson County for almost 4 years now, which is crazy to think about. So I've been a nurse since 2013, and most of my nursing experience is in public health, though I have jumped around a little bit. So I will tell you a little bit more about that later.
Very good. So what is your current position in your nursing role at Jeffco?
So right now I am a nurse home visitor, and I'm working in 2 different programs. One is called the Human Services Collaboration Program. And so we work with families in Jefferson County that are involved with Jefferson County Human Services. So we're working with that department, specifically the Children, Youth, and Families Division. And what we do is we meet with the families and we offer parenting support and education. We set goals with them and provide whatever support they need, whether it's resources or information. And then the other program is called Healthy Start at Home. And I'm sure a lot of people are familiar with Prenatal Plus or Nurse Family Partnership. So Healthy Start at Home is basically an extension of Prenatal Plus. So we're able to work with families so we work with pregnant clients, and we work with them during their pregnancy and then up to 1 year postpartum. So usually our working relationship is long-term. Right now, though, I do have to add that because of COVID, we are meeting with families virtually. So that's been tough.
That makes it a lot more difficult to connect with on their families.
Mm-hmm.
So I know it sounds like you've had some other experiences in nursing. What inspired you actually to look into a job in public health?
So it's been a journey, I would say. I would have to say in nursing school, I was always interested in community-focused healthcare. However, the message that I was receiving that was really to push me to do acute care for a while. And so I did do that, but my goal was to do it for a full year and I was not able to. So I did hop around a little bit, and I did end up, my first position in public health was in communicable diseases. So I was a case investigator in Salem, Oregon. So I was not in Colorado.
Okay.
And since then, I've just been trying different public health roles, and I've landed here as a nurse home visitor. And I would say this is the longest public health role that I've been in, because it's been 3 years now, almost 3 years. And I do really enjoy it.
That's great. What do you find most rewarding about public health nursing compared to maybe your experiences in a more acute care setting? Anything that stands out to you?
Lots of stuff. I just really enjoy the ability to connect with people. And I don't mean that connecting, we have to be all friendly and jolly and, just being able to connect with someone, to be able to provide them resources if that's what they're looking for. sometimes it's just to be a listening ear. People are, especially during these times, going through just so many different challenges. And um, when I give them a call, if I'm just that person that's just listening to them, it's, for me, I feel like that's rewarding. I do also enjoy, with being a nurse home visitor, it's more of a long-term relationship. So it's a long-term working relationship where, you know, um, we're just building and building. It could be a couple months, it could be a year. And for me, it's really special, for just to, be that support person in someone's life for however long, even if it's short term too. Um,
Sure.
yeah, I would say that too, that what's really rewarding is, if I can just be that, just even if it's a little bit of support, or just be, maybe they just had a positive experience with the nurse. If I could be that for them, then for me, that's also rewarding.
Um, Stacy, this is a little bit off what I had planned on asking, but um, in more of an acute care setting, nurses have more of an opportunity to maybe connect at the nurses station. How,
Mhm.
how does that differ for you in public health nursing?
What do you mean by at the nurses station? I'm sorry.
Well, when you're in acute care setting and you're on a clinical floor and you are able to go back, to chart and pick up your patient's records, et cetera, and then talk to another colleague at that nursing center in a hospital, say. How does it differ a little bit for you, and where do you get your support in public health nursing?
Oh, that is such a great question. So I work on a team with other nurse home visitors. With Jefferson County Public Health, we also, our program is not Nurse Family Partnership. That's another home visitation program. But there are a lot of nurses that we can connect with. And primarily I have a small team. There's about 3, 4 other nurses, and we support each other. If a client maybe asks me a question that I'm not sure how to answer, or there's a really difficult situation, I know I can call on any of them. And also too, we have mental health specialists that we have meetings every week where it's our team and then the mental health specialist is there, and we call it case conferencing. So if I'm having a really tough time with a client, or I just need some additional support, then my team is there for me.
Very good. I asked that question because I know that is one of the challenges. And what else
Mhm.
would you say is is challenging about working in public health nursing?
I would say what's challenging for being a nurse home visitor, especially working with families that are, um, have had um, a lot of reports from, CPS, Child Protective Services. There's a lot of different challenges. Sometimes maybe most of the times they don't even want to meet with us. However, we are there and wanting to provide that support to them. Um, Sometimes it may feel more like a requirement for them, and that just can be challenging for that
Mhm.
working relationship. Um, Also to connecting with them, there are some clients that don't, their address changes frequently, or they're
Mhm.
homeless, or they don't have a phone or email, and it can just be really tough to connect with them. And sometimes too, what's challenging is you just really, really want to reach out to that client. You really want to be that support person, but it might just not be a good time for them. And that can be really hard because, we might take it personally, like, oh, what did I do?
Right.
Is it me? So just kind of stepping back and changing the way that we think can be helpful.
Okay. Thank you. How do you feel like, and it's great that you are really in your sort of the beginning years of your career as a nurse. How do you feel like you've grown as a nurse in public health nursing? What is kind of, what do you see that has helped you to grow?
I would a huge thing that I'm thinking right now is patience.
Mhm.
Because I just feel like with with the families that I work with, the clients that I work with, I really have to be patient and understanding. And at the same time, I do have to set boundaries and have and expectations with families. So there I have to find that balance. And I feel like
Mhm.
working in public health, that's really helped me. Um, trying to think there's so much. I'm trying to think what
Yeah.
else.
Well,
Um, sorry, go ahead.
I'm glad you mentioned actually professional boundaries because I think it is across the board in nursing a challenge and it's something that you develop and grow with. But I do think in public health nursing, it's even more important. And so I'm glad you mentioned that because I think that professional growth for every nurse is it's challenging and it comes with time. But
Mhm.
listen to our patients, we do learn from them, and
Right.
they certainly
Well,
help us.
exactly. Well, also too, when you're meeting with a family long term, sometimes that boundary line might feel blurred to them, or they might be a little
Mhm.
bit confused. And then so that can be challenging. I've heard of other nurses who have told me that, old clients or clients would try to add them on social media and just like,
Mhm.
"Oh my goodness, how did they find me?" But
Yeah.
technology. Um, I would say another thing too, just to kind of add on to that question, another thing that what I've learned in public health and working with these families is not to take things so personally, because I feel
Mhm.
like when I first started, if a situation happened, I did, like I mentioned, I might be like, what did I do? It was me. I did this. And just to step back and not take things personally.
Right. Right. I think that's very important because even in an acute care setting, you can sort of get fired by a patient, they
Mhm.
another nurse, and that's always really hard. But yes, you're absolutely right. In a long-term relationship, it can happen more often. And there, many of your families that you're working with are high risk, so that
Mhm.
can happen more often. Um, with the pandemic, and this is, I think, a challenge for every nurse, no matter what career path they've taken, but what would you say has impacted you the most during the pandemic as a nurse?
I would say not being able to do home visits. So switching over from being, knocking on someone's door, meeting with them face to face, and connecting that way, we're on doing phone calls or video calls. I would say most people don't want to do video because it's not
Mhm.
required; it's an option, and
Sure.
most people want to do phone calls. And that's been challenging because it's so easy not to answer a call coming in
Mhm.
versus someone knocking on your door, like, "Hello, I'm here. We're
Right.
supposed to meet at 2. Oh,
Right.
you're in the middle of laundry. I'm here."
Right.
It's
Yeah.
a little bit different. So what's been challenging for me and the other nurses right now is just being able to hold on to that client and spark their interest in our program, because it seems like a lot of people have been short term and just
Mhm.
disappearing on us.
Right.
Yeah, so that's been challenging, and like I mentioned too, it's just the connection piece, because
Mhm.
when you're talking to someone on the phone, I would say a lot of people have been really open with me, with their experiences and what's going on. However, it's just different when you can't see someone face to face. You can't see their body language,
Right.
especially with children. We want to make sure the children are safe. We can't even see the home
Sure.
or
Sure.
the child. So there's been a lot of challenges for sure.
Yeah, I would think that would be one of the, I mean, some people don't have this type of technology available where you
Mhm.
can actually do a Zoom home
Mhm.
visit. So
Right.
really relying on more in a sense, simplified technology like a phone call to
Mhm.
with people.
And
Yeah.
I didn't even that just made me think of something too is phone numbers. A lot of our
Yeah.
clients, they have month to month plans or they change their phone plan pretty often. And so their phone numbers changing or
Mhm.
they don't have a phone at all. And so that makes
Mhm.
it challenging to connect with them.
Well, in economic, these families are very vulnerable to instability in their fiscal, their financial environment and resources, I guess I really should say. And the pandemic has only made that harder
Exactly.
for all of them.
Hmm.
Um,
Especially
Go ahead.
losing their jobs.
Yes, yes,
Big.
yes. Some of them, even the jobs that they had, have,
Hmm.
they've been put on furlough.
Hmm.
That's real challenging. Um, what would you say, if any, new skills you've maybe picked up during the pandemic as a nurse in public health?
I would say during the pandemic, communication, just setting better expectations with the families that I'm working with, and just giving them more, just like explaining our program a lot better. I'm sending them an email if they have email with more information than when I was meeting in the homes face to
Mhm.
face. I might give them a paper here and there. But I feel like uh, I'm just setting the expectations better with our programs. I'm not sure how to explain it.
Yeah.
Uh, and then another thing too, I would say is just my organization.
Yes.
Because when I would meet with families in the home, I had paper to write on, but it was, I'm
Mhm.
trying to listen and write things down at the same time, but show the client that I'm listening without
Right.
just writing down. So
Right.
it's just total like scribble, scrabble,
Yeah.
you can scratch and notes.
Right.
And so now I feel like I've been able to organize my calendar better, my notes better. So those are a few skills.
Sure. Sure. And it's a little bit different to apply the nursing process in public health nursing and in home visitation than
Hmm.
in some of the other nursing settings. So, um, what else would you like to share with other public health professionals or nurses from other specialties about public health nursing?
That's a good question. I'm not really sure right now. I'm sure I do have something to add. I have to think about that a little bit, but I mean something that I just want to add for myself is that when I when I started this program, working in these programs with Jefferson County, I I wasn't really using my Spanish speaking skills at
Ah,
all.
yeah.
And I'm not a fluent speaker. I'm more of I would say an advanced speaker, but I wasn't using
Mhm.
it. So it's like, when they say if you don't use it, you lose
Yes.
it. That is
Yeah.
so true. And
Yes.
so by being the at the time, now we have another bilingual nurse, but at the time there weren't any bilingual nurses on the team. And so I hopped in there and I used my skills and I'm able to speak Spanish better, but the importance of that is that we can reach out to the Spanish speaking families in our community and provide them with the same information and resources as well. Um,
Very
I
good
mean, we do
point.
have translator
Mhm.
lines, but it's just a different way of connecting with more people in our community. So
Sure.
that's something that I'm just happy that we're able to do. And then I feel like Jefferson County really pushes for that.
That's great. I know I have heard from other public health colleagues of mine that they've had to fill other roles at the health departments. Um, have you been, have you been pulled to do other, like to do a COVID-19 line or to do the tracing?
Mhm. Yeah, yeah. So I would say two other nurses and myself, we were pulled in to do case investigations for COVID.
Mhm.
And so we did that for several months. And for me, it was, I would say at the beginning, it was exciting because I had worked in, and I don't mean exciting that I
No,
want people
right.
sick, but
No,
to use that skill again of
sure.
investigations. But then just as time went on, that heavy feeling of COVID and the community and just seeing where it was going was weighing on me. So that was tough. But yes,
Sure.
I did
And
participate.
and it's challenging then to keep up with your own responsibilities in your program as well as doing. It's just like for nurses in acute care settings where when they get floated to another floor, and
Mhm.
and then but when you come back to your own floor, you kind of feel like you've been out of sync
Mhm.
a little bit too. So
That
that
did happen for sure.
yeah can be really challenging. So um, any other thoughts you'd like to share before we close?
Let me see. I did write some things down.
Oh,
Let me
good,
see
good.
if I had
That's
anything
terrific.
I wanted to
Because
add.
we've got
Oh,
time.
okay, perfect.
Yeah.
Um, I think I kind of talked, well, I mean, I guess I just wanted to stress that I kind of mentioned it before, but not when we work with our clients, not every client is a success story,
Sure.
where you meet with them and all their problems have gotten better, and sometimes the working relationship ends abruptly.
Mm-hmm.
And um, I've really had to learn not to put myself, like if there were a circle and the
Mm-hmm.
client is in the circle, I've really had to learn not to put myself in the circle with them and just kind of be that person on the outside supporting them and not in there with them, if
Right.
that makes sense. And because what was happening when I first started was with my first couple of clients, I was, whatever issues that was going on in their life, I was right in there feeling it with them, and I was getting
Mm-hmm.
very emotional. And I during our team meetings, I had cried. I went, "Oh my God,"
Uh-huh. Yeah.
and
Yeah.
I and not to say I that wouldn't happen now, but it was happening pretty frequently where I was just
Sure.
here with them. And so I really had to learn to step back and be that person on the outside and to
Mhm.
support them. However, like I mentioned, if they might not meet their goals because it's not a good time for them, just some of them live a really chaotic,
Right.
busy life for
Mhm.
different reasons. And so, yeah, I'd have to say that that is something I've had to work through.
Yeah. And that I think that crosses over in any area of nursing, but it stands out a little bit more, I think, in public health nursing, where you're doing, you're you're working to help support them to become more self-efficacious, and
Hmm.
and that's hard. That's a hard process, not to promote dependency, but to help them to be more self-sufficient and
Hmm.
that. And not that that isn't a part of all nursing when you're taking care of a patient and helping them to return to whatever health status that you're trying to help them to achieve. But I think it becomes more complicated when you're working in a long-term relationship as well.
Hmm.
So yeah,
Right.
thanks for sharing that. I think that that goes along too with that growth in nursing, that you begin to learn how to step back and
Hmm.
and not feel that responsibility for that patient's progress. That you help them then to take on more of their, to be more, promote their own self health and not depend on others to do that for them. So,
Mhm. Right, and that
so
can be challenging because
yes,
they might not be in the place to do that.
right.
And whereas, and another thought that I had is as nurses, I feel like, or, I know as a nurse, I feel like I want to fix everything for everybody.
Yes, yes.
When I first started, I was doing a lot of information dumping, whatever issue they had or resource they needed, I would just bring everything, and then
Yes.
they wouldn't follow up on it.
Mhm.
They would ask for something or maybe not ask. And then the next time I meet with them, they didn't call the resource or
Right.
look at it. And I realized that, even if I do have, I guess, even if I do have those tools with me, I don't have to just throw them out. I need to listen and figure out what this client's actual goal is.
Yeah. And what kind of resources they have to reach that goal, where they're at in life.
Mhm.
Yeah, because baby steps are sometimes what they need, and they
Right.
try to move forward too quickly, and that doesn't help. Sort of. I think we can all relate to when a patient tries to quit smoking or tries to stop an addictive habit. For any of us, um, you think it's going to be easier than it ends up being. So,
Mhm.
so
Yeah, it's not easy.
yeah. So, any final thoughts, Stacy? You've done a great job
Oh, thank
covering
you.
some. I think of the. I love all aspects of nursing, but I really, really enjoyed public health nursing.
Mhm. Yeah, me too. I found it and I tried to go away from it a little bit and I always find my way back. So,
That's great. That's great. Well,
yeah.
thank you so much for sharing your time and information today. And I know others will find this, interesting and hopefully tell others a little bit more about both how public health nursing differs from other specialty fields, but also you're a nurse, you're a nurse, you're a nurse.
Mhm.
And so we no matter what, we've got that license to practice nursing, and I think it's the art of caring and applying nursing that really comes across in public health. So thank
Definitely.
you again. We appreciate it, and I will look forward to meeting you sometime in person.
I hope so. It was really
Yeah,
great to meet you and thank you so much for this opportunity.
you're very welcome. Thanks.
All right, thank you.
Bye bye. Have a good rest of the day.
You too. Take care. Bye.
Bye.